Outstanding. Well, I guess it's still good morning, colleagues. We have one briefing today, Department of Labor, basically an update on family and medical leave insurance. We have Secretary, Department of Labor, as well as Assistant Secretaries, some Deputy Secretaries, and some policy directors. They're here to let us know the path that we're on, family medical leave, and any issues that they may have. So I would ask that you allow them to present and then hold your questions till the end, and I will grab onto you as I've seen you basically pop up. So without further ado, Madam Secretary, thank you for coming today.
Okay, there. Thank you, Mr. Chairman. Thank you to the Vice Chair and members of the committee. I'm Portia Wu, Secretary of Department of Labor, and the Maryland Department of Labor is charged with implementing the family and medical leave law that the General Assembly passed during the 2022 session. In April, we established the division, the Family and Medical Leave Insurance Division, FAMLY for short, and I'm joined here at the table by some of our leadership, Elliot Skur, at the end, Assistant Secretary of the Family Division, Dan Newberger, our Deputy Assistant Secretary, and Regan Vaughn, our Director of Policy, as well as many of the other team members are here in the room with us. We're here today to provide the committee with an update on our progress in creating a paid leave system for Maryland, which will allow 2.8 million workers to take care of themselves and their family members for serious family and medical leave events, cover 180,000 employers, and in the first year, we estimate could provide benefits for roughly 165,000 workers for a qualifying event. Next slide. So just as a quick overview and reminder, the family and medical leave insurance system established by the Assembly will ensure workers are able to take time away from work and receive job protection and receive benefits up to $1,000 a week based on serious medical conditions or for a new child. The Moore administration is committed to building a strong state paid leave program, learning from best practices and experience of other states, and of course, working collaboratively with our sister agencies. I just want to highlight a couple ways in which paid leave is good for Maryland's economy and ensuring our state remains competitive. First of all, paid leave makes our economy both more equitable and more competitive in some key ways. Several nearby jurisdictions, including Washington, D.C., Delaware, and New Jersey, now have their own state paid leave program. So we are keeping up with other states in the region. Additionally, as the Comptroller's recent State of the Economy report revealed, women in Maryland have returned to the labor force at a lower rate post-pandemic than workers in general, particularly women in the 25 to 34-year-old age group. Paid leave has been shown in other states to bring women into the workforce and to help keep them longer term. So paid leave is an important part of increasing our labor force participation, particularly among women. Paid leave is also good for employers. The research shows that employers with paid leave benefit from reduced turnover, higher morale, and greater cost predictability while employees are away, compared with the unpredictable costs of having to pay an employee's wages or otherwise cover costs while they are out. And I will say the Maryland law pays particular attention to small businesses and the needs they have. And the family system is designed to level the playing field so small businesses, of which Maryland has many, can compete for top talent with this valuable and affordable employee benefit, which historically is, larger employers can already offer this. This will enable smaller employers to have the same ability. And finally, paid leave is important for workers. Providing stable income while workers take time to care for themselves or an ill family member results in increased labor force participation, as I mentioned, and also provides greater economic stability. So the paid leave system, the family system, is designed to provide flexibility for employers so they have the options to select. Either they can buy into the state plan or they can purchase an approved commercial plan or self-insure. I'm going to talk, turn it over to my colleagues to talk in more detail about the progress we've made. I do want to say overall, this, as I've noted, this is an ambitious program. It's a comprehensive program. We will have legislation before the General Assembly this term, and I want to thank Delegate Chief for her leadership on that. To make adjustments to the program as we've worked on the implementation and administration, we realize there's some clarifications that need to be made. We also need some adjustments to the timeline because, as I noted, although this was passed in 2022, we did not receive any budget or personnel until this past spring, about 8 months ago. So obviously, for such a comprehensive, massive program, there's a lot that still needs to be done. But I want to thank the chair and the committee for their support. And now I turn it over to Assistant Secretary Elliott Skur.
Thank you, Secretary Wu, Chairman. We have a few slides to go through. We want to take some time to talk about our progress to date, and then we'll be able to take some time to talk about the next steps. Move to the next slide. So we've spent a lot of the past 8 months since our team has started to be created, writing the rules and creating the foundation for the program. We have benefited from the foresight of this committee in legislation in previous years of requiring us to engage with our stakeholders and constituents in drafting the rules that will govern this very transformative program. We have gone above and beyond the regular regulatory process, which involves publishing proposed regulations and receiving comments and publishing final regulations. We are going to do all of that after this session, but we spent the last 6 months going above and beyond that formal process, engaging with our stakeholders in the ways you see on the slide here. We held 9 public meetings. We published 12 discussion documents. We held over 20 plus meetings with our partners and more in other forums as well. We received many comments and responses to our call for discussion. We've incorporated that. We've had an ongoing collaborative process with our stakeholders. This program, we can move to the next slide. This program won't exist without the rules of the road. We have some next steps here. We're going to publish our draft regulations shortly, in a matter of weeks, for our stakeholders to comment on. We're going to issue guidance, and we're, of course, going to go through the formal regulatory process after the end of the session. Move to the next slide. So this program will not be able to pay benefits until we are able to collect premiums. This is an insurance program. And so we need to establish both the rules, the IT infrastructure, and the processes and organizational structure in place to receive premium contributions. We've accomplished a number of steps towards this goal. One of our first accomplishments earlier this year in the spring was to receive and publish a cost analysis that formed the basis of our recommendation for the rate of premium contributions. We published that in September, at the end of September, for a statutorily established deadline of October 1. We've also performed an exhaustive review of existing state systems that could help us collect premiums. We've initiated a procurement process starting last week to start the process of building a system in order to collect mandatory premiums from every employer in the state. Next steps for us are to build and launch this premium collection system, register the approximately 180,000 employers in the state in that system, and begin contribution payments and informational reports that we need to run the program. As the Secretary mentioned, this program provides a large amount of flexibility for employers. We appreciate the flexibility that's built into the law for employers to make the right decisions for their businesses. They can comply with the law by self-insuring or obtaining an insurance plan sold on the private market. And so in order to do that, we need to establish a new market in the state for certified and approved insurance plans to provide family medical leave insurance. There are a number of steps that we need to go through along with our sister agencies to make this a reality. We've accomplished a number of steps towards that goal. We put in a lot of work researching other states and best practices on how to establish a new market for regulated insurance products. We've begun our coordination very tightly with the Maryland Insurance Administration, with whom we'll share some regulatory and oversight responsibilities. Next steps for us on the insurance marketplace is to continue to work, of course, with our stakeholders to refine the rules that will regulate these plans and coordinate with the Maryland Insurance Administration on the approval process of for commercially available products. So now we get to the main event, which is delivering paid leave benefits to workers. All of this is in the service of allowing workers to easily access benefits and to receive wage replacement, which means a check or some monetary compensation during the period they're out on leave. To do that, we know that we need to have a digitally native system for workers to interact with our office. And that takes time. It takes time to build and acquire in the state. As I mentioned, we have initiated the procurement process to build and improve and iterate over time our paid leave benefits delivery system. And throughout everything we do, we want to engage our users and our constituents. We've done that. We've proven that we do that with our regulatory engagement process, and we'll continue to do that as we build out our digital systems for both employers and employees. We've already begun that process for our paid leave system. We want it to work with end users, with people who will actually be using it, workers in the state of Maryland. And so we've already done a lot of the legwork to set that in motion. Next steps for us, as we go through this procurement process and as we work with the state's Department of Information Technology to make sure that we have a user-friendly and aesthetically pleasing online interface for workers to interact with us, we need to build and launch this system. And so that will be, in the coming months and years, a big part of our focus will be making that a reality. Once that's in place, we actually need to have the organizational structure in place to receive and process what could be over 200,000 claims a year or 3,000 claims a week. We need to make sure that we have the IT systems in place and the organizational structure in place in order to receive that magnitude and volume of claims. As I mentioned, we take our role very seriously of talking with our constituents, stakeholders, users, employers, insurers, workers. We have already, throughout the past 8 months, we've gone across the state in person and virtually to hear from our the people who will ultimately benefit from this program. We've incorporated a lot of the feedback we've received into our proposed legislation, our proposed regulations, and the design of our digital products. We've conducted a number of presentations statewide, dozens of presentations statewide, more than 600 attendees at these events. Next steps for us are to continue to build out our capacity to deliver a full-scale public awareness campaign across the state for employers and employees. And then ultimately to be able to leverage that public awareness into interacting with this program in a way that is both compliant and useful for workers and employers. And so that means giving tools and resources to employers and employees to remain compliant and to be aware of the program and to take advantage of it when appropriate. So I hope that was an adequate overview of our progress to date, I'll turn it over to my Deputy Assistant Secretary, Dan Newberger, to talk a little bit about our next steps moving at breakneck speed. And then I'll come back and we can close out and happy to talk about your question.
Thank you. Moving ahead at breakneck speed. If you're going to move at breakneck speed, it's really important to first make sure you have solid footing. And that's really what we've been doing these last 8 months. Most of the work we've been that's been occupying the team has been challenging and time consuming, but we've really set the stage for rapid growth and scaling moving forward. And those primarily around hiring and procurement as the main thrust of our work. In May, our leadership team was onboarded. Since then, we focused on hiring to accomplish the initial tasks of engaging with our stakeholders and developing policy in a transparent manner. So now we are working on filling out the leadership tier of the organization, focusing on our employer services team, accounting, digital services, human capital management, insurance plan compliance, and of course, our claims and benefit services team. And all of that has been done with help from our partners at the Department of Budget and Management, working to make sure that we're able to hire as fast as possible into the state system. And they've been great partners. And simultaneously, we've also been working to navigate the state's procurement system so that we can bring in the industry partners we need to be successful. And as you all know, state procurement takes time, but we've really laid the groundwork over the last 8 months that's positioned us to move at speed and to scale quickly in this next year. Like Elliot mentioned, we have our first procurement up and running, and it's happening quickly and also at a really high quality, thanks to our partners at the Office of State Procurement who've been guiding us through the process. So now I'm going to turn it over to our Director of Policy, Regan Vaughn.
Thank you. Good morning. As you've heard from my colleagues, we have been working to get this program set up. We've been talking to our stakeholders. And as we've worked through that, we've identified a few areas in the existing statute that we have some suggested changes for. That either our stakeholders have brought to us, or as we've tried to write the rules, we found some conflicts, we found some areas that needed to be smoothed out. So we've been working closely with Delegate Chi on legislation for this year that will come before this committee to help us with those fixes, to make it so the state can administer the program, but also so employers can administer the program within their organizations. For the most part, these are small administrative changes, corrections, and clarifications, but there is one kind of the marquee issue of the bill that we wanted to bring to your attention today. And we are going to be requesting a shift in the timeline in this legislation. That we have found that we need a little bit more time to get this program up and running so that it is the program that will work for employers and will also work for workers. The shift that's included in the legislation asks that contributions begin in July of 2025. That's a 3/4 shift from what's in the existing statute. And so payroll deductions would begin July 1 of 2025, and then they would be remitted to the state at the end of the quarter. Because we need to build up the trust fund after contributions begin, the legislation will also be requesting a shift in the beginning of benefits. And that shift is a 2/4 request so that benefits would begin in July of 2026. As we looked at timelines, we really tried to minimize the impact on workers so that the delay on the employee side would be as small as possible. This timeline gives us the additional time to get the program set up, to engage employers, to get the IT systems moving with the minimal effect on benefit delivery. And I'll turn it back over to Elliot.
Thanks, Regan. Just the last point on that, I want to emphasize that this remains an incredibly ambitious timeline. As Dan mentioned, we feel that given our highly motivated, top-performing team, we can deliver on this timeline, and it can be achievable if everything lines up for the next year. So with that, I'll just conclude. Much of the work we've put in over the last 8 months has set the scale for, has set the stage for the large-scale growth that we need to see quick action. We've invested a lot of time and effort in setting up the foundation, and we're ready to execute in calendar year 2024. We've engaged our stakeholders, we've refined the rules, we've developed trusted relationships. And as Dan mentioned, we've issued our first call for proposals to partner with outside vendors to increase our capacity and velocity. I'll turn it back over to Secretary Wu to engage with you on your question.
Mr. Chairman, we'd happy to take any questions.
Thank you. I'll start. I don't see any. I see a few popping up, but I have a few questions. Elliot, you mentioned Reagan was talking about the timeline and the shift in timeline, and I understand the delay and the need for the delay, but I guess the thing that was a little problematic is you said this was an ambitious timeline. And I say that more to the fact of, are you sure this delay is adequate, or is there more needed? Because that's kind of the key here. You know, I don't want to keep coming back to the trough, you know, ask what you need, ask for what you need this time, versus realizing you're still not going to be able to do it in that timeline. So you said the word ambitious, it gave me a little pause to make sure, do you believe that this delay will give you the time that it takes to get this started?
Mr. Chairman, maybe I'll start if you don't mind and turn it to Elliot for more details. It is an aggressive timeline. We considered other alternatives. We considered, for example, seeing if we could dovetail with other systems like the comptroller system. That looked like it was going to take us out to 2027, 2028. We felt both that was not in keeping with the direction we had received from the Assembly. And also, frankly, we recognize there are things that could impede us making this timeline we've set, right? There can be complicated legal protests and litigation. There can be other kinds of failures. There can be outside intervening events like pandemics. But we felt it was important to set an aggressive timeline because my experience from government is that if you don't try to meet the near-term goals, right, inevitably it's easy to go past the goals. And if we set a goal that's 4 or 5 years out, we'll still find ourselves like being late in meeting those goals. So it felt to us that it was really important to try to stick with a very strong, aggressive timeline, both to meet the direction we got from the Assembly, and also, frankly, for employers as well as workers to understand that, look, this is coming. You know, we've already set out the contribution levels. People will have at least 2 years to prepare and plan and budget, but people need that knowability. So you're absolutely right. We use that word for a reason, which is we cannot guarantee 100% that we will make it, but we felt that it was best to start with being aggressive and going as fast as we can, because otherwise we know, that the work will expand to fill the time. And we felt that it was our duty to try to implement the laws as quickly as possible, given the direction we've been given.
Thank you. I appreciate you understanding some of the shortfalls with bureaucracy. Like you said, the time will be filled with work, no matter how much time it is. I just wanted to make sure that we're, whatever track we set on, that we stay on that track. I want to go on to ask, and again, Madam Secretary, I can start with you. I was not, skipping around you, but, Elliot was the one providing the information. So I wanted to ask about the procurement system, the portal. I understand that we have to basically develop our own, correct?
That's the current path forward, yeah.
So I've just seen it done in the court system and so many other areas where we have found some vendor that is with very little past proven performance, and Maryland's adopted a system that's fairly unique when there are other systems in other states that are demonstrably working. So my fear and I guess my curiosity is when we bid and we go, obviously for other for entities to create this portal for us, are we giving credit for past performance? And in our request for RFP, are we mirroring what other states are doing successfully for what we're asking for? Or are we, because again, I saw it with the court system where they just brought up a new system. DC was using one for 20 years, but we had to have something different. And our something different is still, after 10 years, very hard to deal with. And I'm wondering what your feedback is on, ensuring that we don't overcomplicate this as we often do and try to recreate the wheel when there's 20 wheels out there already.
Yes, that's a very good point. We have worked very closely with the Department of Information Technology to identify the right way to build and maintain a system that will work for both employers and employees. So at a high level, the strategy is that we are going to learn from best practices in other states and make sure that we have a best-in-class system. We're working very closely with Do-It to identify the parts of the system that can be used that already exist. We don't want to reinvent everything. Absolutely true. We know that there are unique parts about a paid leave system in Maryland. And so we are working to find the right balance between using existing and tried and true pieces of technology with the kind of customization and unique features in a leave system in Maryland that we know we need to deliver with the IT solution that we acquire. To answer your specific question about the qualifications of the vendor, we did make it very clear in the solicitation. We put minimum qualifications that require vendors to have similar experience doing very similar things in other states. And so we are going to take that very seriously and evaluate vendors on that. And so that was minimum qualification, but we're also including past success doing similar projects like this. We're weighting that very highly in the way that we're going to evaluate any potential partner that we might engage with.
And again, I appreciate that because when it comes to our detractors, any stalls like that, that's what's going to hit the press. I think we had a similar issue with our healthcare plan when it first popped out, and I want to make sure that we don't have to do that again, guys. There are other states that have done this well. They may not be perfect, and we can do, New York Plus or whatever you want to do, but we don't have to. And I also ask that we avoid letting perfection be the enemy of the good, because you can ask for the moon on a popsicle stick, but sometimes you're just going to get a sticky, stick. So I would really just ask that you be mindful. I've watched this in the past, and all eyes are on you guys, and there are people that are going to say, I told you so as soon as they can. So please don't let that part be the part that breaks. I want to move on to when we talked about organizational structure and IT structure, obviously two separate things, making sure it's robust enough to handle the potential number of claims per year, correct? All that to bleed into, we have discussed prior about how we were going to handle basically the intake. What we talked about either a state system, a third-party system, or a myriad of eventualities that meet between the two. Have you guys decided yet on how we're going to roll this out? As far as we have the call center or the intake part versus the decision makers. Do we have a vision on how that's going to look?
Mr. Chairman, I'll start.
Of course.
We have not made a final decision on that. In part, I think we've been learning as we're going that, each of these pieces takes a while, and both procurement. So if you were going with an outside vendor and hiring, both are lengthy processes within the state. So each of them has their own pitfalls. I think we are trying to figure out what, really our guiding star is what is going to provide the best service for Maryland businesses and constituents, right? That is the most important thing. So we will be, but we are certainly open to feedback on that and are exploring options. I do want to also say, I neglected to mention earlier that we're very fortunate to have Elliot as our Assistant Secretary secretary because he actually was on the leadership team of DC as they stood up their paid leave system over those key years. So I think we have the benefit of learning from other states' mistakes and successes, and there's a whole hybrid of approaches out there. So we know there could be pieces that are handled by us, could be pieces that are handled in other ways. Obviously, we're very dedicated to supporting state staff who are doing excellent work, but it may make sense to have some pieces handled by outside partners.
And another big piece of our strategy in order to handle a potential volume of claims is to rely on automation. We want to make sure that our claim system can minimize the amount of human intervention we need on for every claim that comes into the door. Just to return to another point you made, Mr. Chairman, we want to make sure that we deliver a workable piece of software on day one. And a big part of our IT strategy is making sure that we have at least a minimally viable product on day one. Mm-hmm. That's the solution to make sure that we don't try to jam everything in on day one, that we're able to improve over time, we're able to learn from our experiences. And that's how we remain confident in the timeline, because we are confident in what we're going to deliver on day one, and we're going to improve over time. Another kind of unique, or not unique, but one of the features in the Maryland law that allows us to be confident that we can handle the volume are the private options. I mentioned a potential claim volume of 200,000 claims a year, which equates to about 3,000 claims a week. The important point about that volume is that is what the actuaries expect statewide. No one knows yet what the volume of private plans will be. We know that it's going to be more than zero. And so the actual volume of claims handled by our office will be something less than 3,000 a week, because some amount of those claims will be handled by private plan. We hope to get some more information from actuaries and economic analyses that we're going to do to try to predict what private plan take-up will be, and that will help us scale our organizational structure to meet the demand.
And I understand that's a very difficult prediction. I guess you can model yourself after other states. I've just seen a varied number, even state by state, on participation via private versus going through the state system. But I would just ask you to be mindful of the state staffing shortages that we already have. And I think it's very difficult to find good and qualified candidates to actually fill these positions, especially with the pay we tend to pay our state employees. So please be mindful of that. And you mentioned automation, and I'm over 50, so I guess I'm scared of that. Only in that it's very frustrating when you get stuck in this call loop that many people get, and then they end up calling us because they couldn't get through to a person. So, and I'm sure in your development phase of that, you'll be mindful of that. That automation is great, that first round, but people are going to want to talk to somebody, especially people in need. And all these calls are going to be people in need. So I just, again, please, with the automation, we overdo it sometimes. Lastly, when we talked about the public awareness in your, do you have a model in mind? Because that in itself seems like a very gargantuan task, getting people to understand not only that this is going to exist. And I say that because they're going to notice it out of their check. And, obviously the timeline of when we do it is important, well before they start taking money out of their check, and the options that they have. Do you have a model that you're going after as far as another state, or are you still collecting, data as far as what you're going to need to make sure it gets out there before you begin to develop the model?
Or Regan?
Sure. So we have an outreach lead was one of the first in the first round of hires, knowing how big outreach would be as an issue for us and to work on. We also have strategic communications team member on who are working closely together to figure out what that model will be. They are in close contact, talking to the other states that have done this on how communications and outreach work together, the best way to reach businesses, what outside partners we might need, what we can do in-house, and what that staffing model should look like. So there are beginnings of a plan that have been put together, but we really are looking at what other states have done so that we can change that for Maryland, recognizing the different jurisdictional needs, for the different parts of the state and how we can make sure we reach each corner of the state to let employers and employees know that family exists, why there's money coming out of their paycheck, and then that there's a benefit available for them to take. There's also a lot of research that's come out of the DC program and the New Jersey program and California, talking about where outreach went wrong. And we've been looking at those reports as well, so we can learn from them and not make those same mistakes.
Thank you, Mr. Chair. I just have two brief questions. You had a slide up there that mentioned the meetings and the information you all gathered with your partners and what have you. And there was a lot of emails and stuff. Are they available publicly? Could we look at some of those to get a better understanding of what all has happened in the midterm on all this stuff?
Yes, all of our correspondence and draft documents are currently on our website and available for download. Yeah.
Okay. The other question, Ms. Secretary, you mentioned something about women are not coming back to work. What are they doing? I mean, or how are they living? I'm curious because we see a whole lot of pre-pandemic numbers that used to work here. I don't know, what are they collecting unemployment? How are we living if you're not coming back to work?
Delgado, I think I'd have to do a little more research, but I think, people rely on a host of things, right? They rely on savings. They I think we have a lot of factors going on here, right? We know people aren't moving as much as they may be used to. They may still be living with family. They may have caregiving responsibilities, especially that demographic of women, 25 to 34. We know there were a lot of families, for example, who during pandemic went to homeschooling or supporting children at home. There may be people supporting elderly parents or other people, part of their family. So, women's labor force participation has always been somewhat lower than men's, but Maryland has historically been very high on both sides. And so that change was really notable to us, that it has not come back and it's reflected in the comptroller's report. There are a host of factors and a host of strategies families may be using. It's difficult to say, at the very local level. But we know from seeing the experience of other states that things like paid leave make a difference for, especially when a woman might leave the workforce because there's an ill member of their family or a new child. Do they come back? Because, sometimes they feel those first few weeks they can't make it, so they have to make other big changes in their life.
But I think we've seen both men and women.
There's definitely been a lack of return at the same levels in Maryland for both men and women. You're absolutely right.
Okay. I guess it just troubles you because there is a tremendous amount. I mean, our unemployment rate is almost non-existent right now. And I was wondering, do we have high numbers of people that just don't want to come back to work, or how are they still collecting the unemployment and what have you? Or are we just
So we no longer have extended unemployment benefits in Maryland, and we haven't for quite some time. And actually this goes to the chairman's point about making sure people are educated. Honestly, it's been a confusion for some people because things changed during the pandemic. They've come back. We do not have super high claims right now, although we do have people who are, of course, experiencing job loss in the way they always would during any economy. But I think we see, to your point, the reason the rate's so low is because that only counts people who are actively looking for work. And we have a portion of Maryland's population that has not returned to actively looking for work.
Thank you very much. Thank you. Sure.
Thank you, Mr. Chair, and I want to thank the team from the Labor Department for your hard work. I had several conversations with you. I know how hard you have worked, and I'm very pleased to see Reagan being hired. Going from an advocate to working for the Labor Department to make it happen. I hope you understand where the chair and the committee came from in terms of our tremendous anxiety and our perhaps, questionable confidence in our ability to roll out a program as aggressive as this. So I appreciate your very thoughtful approach to that. Because of the failure of both the unemployment insurance, granted it was previous administration, but also the health exchange program, right, many years later. So we have long memories of failures of those launches, and we just don't want to repeat that mistake. But I also understand that you have evaluated carefully other states' practices, good and bad, and also tried exploring different options in terms of leveraging, for example, the comptroller's office data sets. So you could borrow some time, but it didn't work out. So maybe you could, explain why you chose this option of doing it in-house entirely to reach this timeline.
Let me start. We spent months exploring this, and in part, a lot of that was driven by ease for businesses. I know it's very frustrating for employers and confusing for individuals to say, wait, there's another portal, right? Do I have to go to another place to pay my taxes? And we really tried, and that's why we spent a number of months working with the comptroller's team to try to explore that, because they are redoing that whole tax collection system. Just through those conversations, we came to learn that obviously, because they are doing a comprehensive overhaul, they wanted to ensure that their pieces were in place first. And that meant that family would have to wait to be on the end. I think we are hoping to build the system in a way that eventually can look towards merging it either with the comptroller system, with UI, with some other form of tax collection, because I think we all strongly believe like the fewer places employers have to go, the more we can increase ease of use and clarity for them, the better. And that's also why Delegate Chi, there are some places in legislation where we say, let's try to make these definitions similar to what employers are doing in other programs, so they don't have to have a lot of confusion with their accountant saying, well, is it taxes? Are these wages or are those wages? Like, how do we deal with this? So we're trying to streamline, but I'll let Elliot and Dan speak more to the actual IT pieces and what we explored.
Sure, yeah, happy to. And I would just start by saying we explored a number of options in addition to Compass. We took the responsibility very seriously of trying to make sure that we didn't add another location for businesses to have to interact with. We looked at Business Express, which is primarily used by the State Department of Assessment and Taxation. We looked at One Stop, which is another portal that the state maintains. And we also looked at Compass, which you brought up, Delegate Chi, and that was the most promising avenue that we were able to find of an existing state system. But the primary consideration that led us away from that path was time. We initiated conversations with the comptroller thinking that it could be it could be done more quickly using an existing system, and that turned out not to be true because of the large amount of demands currently being placed on the IT development of Compass to get it working and operational for every tax type across the entire state: business taxes, personal income taxes, pass-through entity taxes. There's a number of taxes that are going to be in the comptroller's Compass system. And so family would have been in line to be incorporated into that system. But that would have put us to the end of calendar year 2026 to begin premium contributions or early 2027, which means benefits would have been a year later. And we running the trade-offs of time and budget and capacity, we didn't think that was the right path forward. And so the current option on the table is to build a system for employers to interact with our office, to submit their reports and to pay mandatory premium contributions in a system that we will build and maintain.
And I would just add, we also, with the help of the state CIO and her team, we did a really comprehensive look at all other existing state systems to see if there was a system already in use that we could leverage. So that process, we spent a lot of time with the help of Do It folks to see that we weren't duplicating work where we don't have to. And so we feel pretty good that that this approach, is the right one based on what we know right now, because we've gone through the list. We've had a lot of conversations with different program teams, see, is there any way we can make this work for our program? And this is where we ended up.
Oh, thank you, Mr. Chair. And thank you to the panel for coming here and briefing us today. When we were originally discussing the family and medical leave bill, there was some discussion about the company Aflac and the fact that they're kind of already in this kind of business. Has that been given any thought or explored, reaching out to them, maybe collaborating with them in some kind of fashion?
We have done a lot of research into what has worked in other states. Aflac is currently the primary partner in the state of Connecticut. It remains an option. I think we're considering and weighing all the options. We want to make sure that we are able to both develop, build, and also maintain a family medical leave insurance for the state of Maryland that works in the long term. So based on just our analysis and weighing all the costs and benefits, our current path, I think, was illustrated by the request proposals that we put out last week for vendor partners to help us build and maintain systems that will be owned by the state. And so that's our current path right now. I think, as Secretary Wu mentioned, we're still exploring options and feasibility. And I think the next year or so, as we learn more and we get closer to the statutory deadlines, we'll have a better sense of any adjustments that we need to make sure that we meet and uphold our requirements.
Right. Thank you.
Was available on the website. Does that include the proposed rates?
The rate?
The rates, yeah.
Yes. Yes.
So can you give me an example of, say, what someone making 50,000, how much they would expect to pay in any given year, plus what the employer would have to match?
Sure. I wish I had the math in front of me. So $50,000, 1% of that would be $500. So under $500, split equally between the employer and the employee. The rate that we published based on the actuarial analysis was 0.9%. And so what that means is that what we expect is that wages up to the Social Security wage base, about $160,000, will be subject to mandatory premium contributions of 0.9%, split equally between employers and employees, so 0.45% for each. And that is the rate for employers participating in the state fund.
Right.
And we expect that will be kind of a target rate for private plans, but private plans will be able to establish their own rates. And if they're able to be more competitive than that, they are able to do that. Or if they want to offer wraparound services, they can do it at a higher rate if they want to offer additional services. But the rate for the state plan is 0.9%. And it also regulates the cap that employees will be required to have deducted from their paycheck. So 0.45% is the cap even for private plans. Employers can make other choices that are right for their business. But I think I got that math right. $50,000 would be about $500 a year, so $250.
But and also for small employers, they only pay the employee side of the contribution. They don't pay. Thanks for reminding me. Yes, the statute also establishes what is essentially a 50% discount for small employers. Small employers are only subject to 0.45%, which are withheld from the pay of their employees.
And the self-insured option, how would that work?
So a self-insured option, an employer will be able to apply to our office using a template that we'll publish just to make sure that the benefits that they're providing are equivalent to the ones that are provided under the state plan. And if they can demonstrate to us, to our satisfaction, that they are able to meet their obligations in the future to pay expected benefits, then those employers would not have to remit contributions to us.
So they don't have to escrow, they're not going to be required to escrow funds or anything. They just have to prove that they have the funds. to fund the plan?
We've discussed a number of options. I think we're still exploring the options. We haven't proposed any formal regulations yet. And so I think what we want to hear from is our stakeholders and businesses across the state about what makes sense and what might be feasible. We did discuss the option or the policy consideration that businesses might have to obtain what is
Surety bond.
a surety bond, which means they don't need to have the funds. They just need to find a third party firm who's willing to sign on and to say they'll cover it if an eventuality occurs where they'll need to pay the funds. But so that I think is one thing that we got positive feedback from our stakeholders was just require a surety bond. There are surety bond companies that provide a bond. And essentially for the employer, it just looks like an ongoing a payment that they would make to the surety bond.
Okay, thank you.
Thank you, Mr. Chair. First question kind of goes back to what the chair and some others had alluded to with setting the system up. Is it possible to ensure that whatever system we adopt, that there's one number, like the Department of Labor number for the employee, or excuse me, the employer ID is going to transfer over into it? Because nothing drives me crazier as an employer than to have 58 numbers, you know, when I log in. And the only state that does it, where you log into Department of Labor, Department of Commerce, whatever else, that is just one number, is Georgia. For whatever reason, all the other states seems like I have, you know, a laundry list of numbers. That I don't know if that's really a question or more of just a comment, but as you're building it out, if we could just have the employer identification number transfer over, that would make life a little bit easier. The second is going to the rate. So I know the date shifted or will shift in the bill, and I know that the chair had made the comment to make sure we're asking for what we need, but it looks like when the dates shift, there's 2 less quarters of collection up front, or 3 less, right? Because you're only going to have 2. You're going to have Q3 and Q4 of 25, and then benefits start drawing in Q6 or 26. Is that correct?
We're expecting 4 quarters because benefits would begin to be paid in July.
Okay, so it's a full year. So it's 1 less quarter.
Correct.
Okay. Are we still confident in the rate? And why did we shift to drawing 1 less quarter? Like what changed in that, or calculus changed? I'm just trying to figure that out.
So we looked at all of the experiences in other states. I think that's a big or was a big source of anxiety, is to make sure that we have enough money in the trust fund to be confident that we're able to pay benefits for at least a full year by the time we start paying benefits, whatever that date is. Other states have been successful with having 4 quarters. The current law provides for 5 quarters of a build-up period. That is more than any other state. And what we didn't, I think we're open to hearing additional recommendations on this. Where we landed in our recommendation was to just follow the best practices in other states where they've been successful with 4, and to not put an additional it would be an additional quarter that workers would have to wait in order to get benefits, but it would also mean that it's just another quarter that employers are and employees are paying into the trust fund before benefits. And we thought that it would be adequate to try to shrink the period and still have adequate trust fund reserves. And that was reflected in the actuarial analysis that we received as well, at a 0.9%, that it would be very adequately and healthily funded.
Okay, I just want to make sure that we're asking for what we need here, because if you start nickel and diming in this and continually changing, things get more and more complex and complicated for everybody. So thank you.
For sure, yeah. Thank you very much. And I think we are, if everything goes right, this should be close to pay as you go as we mature as a program and get into further out years, and we become more confident that what we bring in a quarter can be paid out in the next quarter. And we just need to have a slimmer reserve. Having a year's reserve is a very healthy amount, because we'll continue to receive premium contributions as we're paying benefits through the remainder of 2026.
Madam Secretary, Reagan, Dan, I just want to say, and Elliot, thank you for the economy of words that you used in your presentation. I think it's, you presented things that are pretty much germane to the current state of family, so I appreciate that. Also appreciate you being forthcoming about the change necessary for the timeline. I actually appreciate the vision that you have for currently rolling out this system without pulling the comptroller in. I think sometimes, especially something this novel, having more hands in the pot and more chiefs make things more complicated. So I do agree with the view of once we've gotten this locked in and once this is gelled, then work on. But right now it is a very complex issue. So a lot of times, especially, we almost go down to what we consider political entities. You're pulling other people in, you can really complicate things. So I appreciate that view of trying to make this as simple as we can until we get this ship launched. So I look forward to hearing from, updates from you. I would ask that you continually keep in contact with Delegate Chi, because she's going to be spearheading this as long as anybody listening. If you guys have any recommendations or questions, the subcommittee chair, Delegate Chi, would be wanting and would appreciate any input from this group of folks here. And also Tatiana, who, while she is new to the committee, she's going to be working on this. So please maintain contact with her as well. Colleagues, I appreciate everybody coming. Please don't forget the committee dues are due by January 19th. That's $75. If you want to pay by check, you have to pay it payable to Joy Jones. You've already paid. This ain't about you. If there are no other questions, thank you guys for coming and attending. Madam Secretary, thank you guys. Want to have a wonderful day. Enjoy your lunch.
Sure.
You don't have to touch anything. I just go away. Stop.
No.
It's not weird.
Yeah. Back away. Yeah. I knew it when I was double check.